Hi everyone, my name is Dermot McGovern and I'm Professor of Medicine at Cedars-Sinai Medical Center in Los Angeles. I'm sorry to have interrupted the entertainment for a couple of minutes, but I have a very important message to deliver about why tonight is so important. So please delay mixing that next cocktail for a few minutes while I tell you why we are all here. My team study ulcerative colitis and Crohn's disease, which are together known as inflammatory bowel diseases. And our fight to cure these diseases is what Connecting to Cure is raising money for tonight. These diseases are autoimmune diseases of the gut and now affect, incredibly, about 1 in 100 Americans. The peak age that they develop is during teenage and early adult life, and they can have a huge impact on people's health and quality of life, with the majority of our patients still, unfortunately, requiring major surgery. All this occurring at crucial times for personal and social development, such as going to college, starting a family, and launching a career. Through the support of Connecting to Cure, we have made huge strides in identifying the causes of these diseases. For example, about 15 years ago, we had not identified a single gene that leads to an increased risk of developing inflammatory bowel disease. Now, we have more than 250 different genes. We also now understand some of the factors in our environment that may contribute to the development of these diseases, ranging from things in our diets to fungi, viruses, and bacteria in the gut. Due to these advances, we now have new treatments, we have better ways of predicting how disease is likely to behave, and importantly, markers that will help us to get the right medication to the right person at the right time and the right dose. Each one of these discoveries is one step closer to a cure. However, we have much more to do. Too many of our patients still require surgery. The medications we have can cause serious side effects, and the majority of people's diseases are not controlled with even our best medication. We have plenty of work to do and desperately need the support that Connecting to Cure provides to make sure that we achieve these important goals. I can't let you go without saying a little bit about COVID-19. While this has all been on our minds and is the reason, sadly, we can't enjoy each other's company this evening, COVID-19 is obviously a major concern for people who have to take immunosuppressive medication, such as our patients with inflammatory bowel disease. Through work that we and others have performed, we have actually seen no signals suggesting problems from COVID-19 in IBD patients who have been taking immunosuppressive medication. In fact, work from our group has suggested that there is an overlap between some of the processes that cause Crohn's disease and colitis, as well as those processes that lead to the more severe forms of COVID-19. These findings raise the intriguing possibility that some of the treatments that we are currently using to treat Crohn's disease may be helpful and need studying as treatment for the more severe forms of COVID-19. We have also launched a study so that we can understand the effects of having Crohn's disease and colitis and autoimmune disease in general, as well as the medications that our patients take, on the response to a COVID-19 vaccine when this becomes available. This is particularly important as people with IBD have essentially been excluded from the COVID-19 vaccine trials currently ongoing. The support from Connecting to Cure allowed my lab the flexibility to rapidly pivot to study the effect of this epidemic on people with IBD. My team, together with colleagues Dr. Rabizadeh and Ziering in the pediatric department at Cedars-Sinai, could not do this research and make this progress without the support of Connecting to Cure. And so we are extremely grateful to them and to all of you who have in some ways supported their mission over the last few years. You have made this possible. Support for research has been very difficult to achieve in the current climate, and that's why we're asking if you are able to donate to this incredibly worthy cause. Please enjoy the rest of the evening. Don't forget to wear a mask, wash your hands, and practice social distancing when appropriate. Thank you for listening, and please go and mix that cocktail now. Cheers.